Okay, here we go. Muscular skeletal system, lesson B. So, looking to expand on the knowledge that we picked up in the last presentation. I hope it didn't scramble your brains too much with all that sliding filament theory, but hopefully you understand that now and ready to expand and go forward. So, during this presentation, there's quite a lot of outcomes here, but they're not quite as scientific and detailed as the last presentation. So we can hopefully bang through these quite quickly and get this knowledge on board with you. So we'll be able to name, locate and explain the function of skeletal muscle. We'll be able to identify the anatomical axis and planes with regard to joint actions and different exercises. We'll be able to explain the joint actions brought about by a specific muscle group, and we'll be able to describe joint actions or joint structure with regard to range of motion / movement and potentially the risk of injury there as well. Lastly, 2.9, describe joint movement and potential joint actions, and we'll be able to describe the structure of the pelvic girdle and associated muscles and ligaments. And if you're looking at this now thinking, yeah, I'm confident, then that's great, and feel free to crack on and get stuck in. If you're looking at this and you're thinking, when I did the level 2, I struggled a bit. I didn't really understand the joint actions. I didn't really understand what flexion was, what extension was. I didn't really have a great grasp of pronation or supination, and you don't really understand what they are, okay? Maybe have a little bit of revision on level 2. Go away and look at that again, because this is going to expand on that and take it a step further. But if you're confident, or even if you want to have a little bit of a look and see what's going on here, let's carry on and let's have a crack, because by looking through this, you're not only, in particular for this unit, you're not only picking up the skills to pass the exam, alright? These are things that you need to be able to do as a PT, alright? If you're going to be a good PT, if you're going to be someone that's going to earn the big money and someone who's going to be able to demand 25, 30, 35 pounds an hour, whatever it might be, this is the kind of stuff that's going to help you, and it's going to set you apart from some of those other trainers who maybe haven't taken the time to get this knowledge on board, or maybe they did when they passed the exam and they've gone away and they've forgotten about it. So, when our muscles contract, alright, we have different types of contraction. We have isotonic, concentric, eccentric, isometric, and isokinetic, alright? And first of all, I'm going to look at the top one, which is isotonic, alright? So, it's used to describe muscle actions involving movement, alright? That's all isotonic is. It's muscle contractions involving movement. Isotonic contractions are muscle contractions involving movement. We won't talk about those too much, alright? The big boys, the ones that we need to concentrate on, are concentric, eccentric, and isometric, alright? So, a concentric contraction is when a muscle generates force whilst shortening. So, if we were to do a bicep curl, you can probably do this now while you're sort of listening and watching me. So, arm out in front, you curl your bicep, like you would if you were doing a bicep curl, and you can see your bicep getting shorter, alright? It's moving the elbow and the arm close to your body, and the bicep is getting shorter. That is a concentric contraction. So concentric is generating force whilst shortening. Eccentric, essentially, is the opposite. So it's generating force whilst lengthening. So again, if we look at the bicep, we bring it up towards the body and it gets shorter. That's the concentric contraction. We lengthen it, alright, and we bring our arm back down. So the second part of the bicep curl, that is an eccentric contraction. So, making something smaller, concentric, making it smaller, eccentric, and then we also have isometric. So, muscle generates force and remains the same length. That is if we were doing something like a plank, alright? So, we've got to stay still, we've got to keep our core tight. So, our core is really tight, it's working really hard, it's keeping us stable, but what it's not doing is it's not changing length. That is an isometric contraction. We have isokinetic at the bottom, so that's when muscles move at a constant speed, and we won't look at that too much, alright? Really concentrate on concentric, eccentric, and isometric. Now, we have the different roles that a muscle can play during a movement. You have the agonist, or another word for an agonist is the prime mover. And the prime mover is the muscle that causes a desired action. So, again, if we went back to our bicep curl, alright, our bicep is the muscle. If we do a bicep curl, our main muscle that we're working there, the prime mover, is our bicep. It's the muscle doing most of the work. Alright? If we did a leg extension, it's going to be our quads that are doing most of the work. They're the main muscle that's being worked. They are the prime mover. If we're doing something like let's say we're doing a hamstring curl, the prime mover is going to be our hamstrings. But as well as the prime mover, we also have the antagonist. Alright, so we have the agonist doing most of the work, the main muscle. The antagonist is the opposing muscle. So, if we were doing again a bicep curl, when we curl the bicep, and if you look at your bicep getting smaller, what the tricep has to do is it needs to relax, it needs to get longer. Alright, so it's getting loose and longer, and the bicep is getting shorter. So the antagonist is the tricep, and the agonist, the one that's getting shorter, is the bicep. Same thing if we look at the leg extension, the quadriceps are getting smaller, but the hamstrings are getting longer. They're the antagonist, alright? And that's the relationship between the two muscles. And you'll often find in the body that there are pairs of muscles that work together. One's the prime mover and one's the antagonist. We then have a synergist muscle. So, synergist means to work in synergy or to work together. And synergist muscles are muscles that assist or modify the movement of the prime mover. So, for example, during hip extension, the hamstrings act as a synergist for the gluteus maximus. So, if we're going to extend the hips forwards, so a bit like a hip thrust type movement, if you don't know don't quite understand what hip extension is, extending or pushing the hips forward, the majority of that work is going to be done by the glutes. Alright? Those are the big muscles at the back where your backside is. They're going to be the prime mover. But the synergist, the muscles that help to push those hips forward, are the hamstrings. Okay? That's what synergists are. Then I have fixators. So fixator muscles are muscles that stabilise part of the body that remains fixed. For example, shoulder girdle muscles stabilise the scapula to allow efficient movement of the shoulder joint. Alright, so the shoulder girdle, the muscles in there, work to stabilise the joint. Alright, and the scapula in particular, which is the shoulder bone. They keep that nice and still so that we can have efficient movement at the shoulder joint. So we have agonists, antagonists, synergists, and fixators. And what we want to do now, and I'm going to come out of this for a second, we're going to go to page 36 of the lap. So I just need to minimise this. I'm going to jump in here for a moment, alright? This is page 36 of the lap. And again, same as last time, you need to be remembering this, right? And I referenced it in the last presentation, but we're having a little bit of a look now. You need to know all of this stuff, and you need to know all the columns. And, you know, last time we talked about the origins and the insertions. You need to know these guys, alright? You need to get into this, and you need to be reading it. And you need to know where all these muscles come from. And we also need to know primary concentric actions. So we've just looked at what concentric contractions are. So when all of these muscles contract and they work, what movement are they bringing about? Again, biceps brachii that we've looked at quite a lot. Biceps brachii causes flexion of the elbow, alright, supination of the forearm and flexion of the shoulder. And we'll look a little bit more at flexion, extension, adduction, abduction, etc. in a minute. Latissimus dorsi, or your lats, alright, what do? They cause adduction, extension, and medial rotation of the shoulder. That's what the lats do. The trapezius, or the traps, elevation, retraction and depression of the shoulder girdle. Alright, you need to know where all these muscles are and also what kind of movement they bring about. So, we're not going to spend every sort of, minute reading through all of these. It's level 3, so there is some bit more independent study involved here. But have a look through the chart and make sure that you've got all of these on board, because you're going to need to remember them. If you need a tutorial or you want to go through anything in more detail, I'm more than happy to help you out, but you need to try and get an understanding of these, okay? So back into the presentation. And when our muscles work, alright, they cause movement. And they cause movement along different planes. And in what we normally use to evaluate the planes in the body is we use something called the frontal, sagittal, and transverse plane. The frontal plane chops the body in half, so front half and back half, okay? Sagittal chops it in half a long ways, so it chops it through left and right, and the transverse plane chops us in half at the waist. So, if you were doing an action where you were, let's say, you were standing up and you were putting your arms out in front of your chest. Everyone can do that now while you're sitting down. Put your arm out in front of your chest, bring it back. Put your arm out in front of your chest, bring it back. You are moving along the sagittal plane. Alright? See that yellow one in the middle? You're moving along it. So it's not about breaking a plane, it's not about which plane are you moving through, it's which plane are you moving along. The transverse plane, if we were to shuffle side to side, okay, look a bit like a sidestep movement, that would be moving along the transverse plane. And if we looked at the frontal plane, movements that move along that plane, if you lift up your arms, so sort of like as if you were making a cross shape, a bit like Jesus on the cross, and then bring your arms back down towards your sides, that is moving in the frontal plane. So there's 3 different planes that we need to be aware of. What we also need to be aware of is the axes that we can turn around. So we have 3 different axes in the body. We have the anterior-posterior axis, which is the first one. So that is an axis that runs anterior-posterior. Anterior meaning front, posterior meaning back. So it goes from the front to the back of the body. We also have the medial lateral axis, which goes through from side to side. And we have the longitudinal axis. And what we need to be aware of is how we just looked at page 36 in the lab. And we spoke about looking at when a muscle contracts, what movement does it bring about. We need to be aware of, what axis is that movement on. So if we look at longitudinal, for example, we know that if we turn our head from side to side, as if we're looking to maybe cross the road, alright, that is moving on the longitudinal axis, alright? If we're moving on the anterior posterior axis, okay, we might be doing something like, you had your hands on your hips and you move your trunk to the right and then you move your trunk to the left, that's moving on the anterior posterior axis, okay? Medial lateral axis, something like swinging your arms in big circles, like you're swimming, like you're doing something like butterfly, like swimming, that'd be moving on the medial lateral axis. So it's all about knowing what these axes are and how movement takes place. And we're going to break that down in a little bit more detail and look at the different areas of the body and the movements and the movement potentials that can take place. So first things of all, we have flexion and we have extension. Alright, and as you can see from the movement there, flexing is making something shorter, as we already know. Extension is making it longer. Okay, so flexion, the body becomes smaller, the bend at the knees. Extension, we're standing up. Alright, so that's looking in particular at the quadricep. We could do that for the bicep. Alright, flexion, making our bicep short. Extension, making it long. We then have internal rotation and external rotation. Very, very simple. Internal rotation is rotating inwards towards the body. External rotation is rotating outwards away from the body. We have adduction and abduction. Adduction is a movement that brings something closer towards the centre of the body. That's adduction. Abduction is the complete opposite. It's the movement away from the centre of the body. So, as you can see on the picture, arms out at the side is taking away from that centre point of the body, bringing them back in is adduction and making them smaller. Horizontal extension, horizontal flexion. So if you were looking at doing something like a pectoral fly, that is a perfect example of horizontal extension and horizontal flexion. Looking in particular at the pectoral muscle, bringing that weight in, that's horizontal flexion. Making it bigger, taking it back out, alright, is the opposite of that, which is horizontal extension. Okay, if we looked at the spine in a bit more detail, we have spinal flexion and spinal extension. Spinal flexion, essentially, is leaning forward. Spinal extension is leaning back. So if we extend the spine, we lean back. We flex up the spine, we lean forward. Alright? We have also from the spine, lateral flexion, and we have rotation. So lateral flexion is that trunk movement when we're moving from side to side, as you can see there. And rotation is when the body stays upright and then we twist. That's rotation. Okay, let's have a look at the shoulder girdle a little bit more. Okay, if you shrug your shoulders, push them up, that is elevation. You push your shoulders down, as in the picture, that is depression. Protraction is pushing the shoulders forward. Retraction is putting them back. So if someone says, stand up straight, get those shoulders back, that's retracting the shoulders. Okay, let's have a little bit more look at the limbs, and in particular the lower part of the arms. Flexion and extension of the bicep, which we've covered quite a lot, is the first example. We have pronation and supination. So, pronation, palms facing down. Supination, hands facing up. Easy way to remember this, alright? If you did supination, two hands together, facing up, a little bit like a bowl of soup. Your hands look like a bowl of soup. So that's supination. Pronation is the opposite of that. We look at the hips a little bit more. So hip extension is moving those hips backwards towards the spine really. Flexion is picking up that knee, alright? Picking up that quad. That movement right there that you see, this second one here, that is not a movement that comes from the quad, right? The quad's quite relaxed there. That is a movement that comes from your hip. That is hip flexion. We've also already covered abduction and adduction, but essentially it's moving your leg away from the body or closer to the body. We'll keep looking at these. Continuing on the legs, we have external rotation, internal rotation. Very simple, same as the upper body. External rotation twists away from the body. Internal rotation is the opposite, and putting and forcing the body or twisting it more towards the inside. Circumduction. So we can also have circumduction going on. Circumduction is when sort of the spine and the upper body stay still and your limb rotates. So if you put your arm out and make little circles, that's circumduction. Put your leg out and make little circles with your ankles, that's circumduction too. We also have flexion going on here. So if we were to get down into a squat position, alright, that's going to be a little bit of flexion going on for the sort of the glutes and the muscles there. We also have, to finish off, ankle movements. So we could have some flexion, knee movements first, flexion at the knee, or extension. So knee flexion, alright, because people always get confused with knee flexion. Knee flexion is bringing your leg back like you're about to take the first stride of a run. Bringing your leg back like you're about to kick a football, alright, that's flexion. Extension is then pushing back out. It's the opposite. It's actually kicking the ball. Flexion's bringing it back. Extension's pushing it forward. So if you imagine a knee extension machine, that's the movement that you've going on. We also have eversion and inversion. So this takes place normally at the feet, could also be the hands. Eversion is the tilt, as you see there, away from the body. Inversion is tilting in towards the body. So if you look at your feet now, eversion is making your little toe point away from your body. Okay? Inversion is making your big toe point in towards your body. Those examples. And then finally, we have dorsiflexion and plantar flexion. Dorsiflexion means to point up, like a dorsal fin on a shark, for example. That's dorsiflexion. This normally always happens at the ankle. Dorsiflexion is to point up. Plantar flexion is to plant your foot down on the floor. That's plantar flexion. So, once again, you might need to have a look through these and replay them and get to know them, but those are the joint actions and movement potentials. We've pretty much covered all of the body there. And it's about making notes and taking this on board and making sure you've got it learnt ready for the exam. We've then got bony landmarks of the pelvis. Pelvis is really important because it helps support us, it helps keep us strong. A lot of the movements that we do come from the pelvis and the core, which is quite sort of a buzzword. Use your core, you need to engage your core. But we're talking about the pelvis and the sort of abdominal region. And we need to be aware of the bones which make up the pelvis. And what I've done here is I've labelled them all for you. So we've got the posterior superior iliac spine, all right? And you can see where that is just here. We have the sacrum right at the bottom of the spine, which we should know about from when we studied the spine at level 2. We've got the anterior superior, okay, iliac spine. So again, remember posterior means back, anterior means front, okay? We're talking about these bits here, the back of the ilium and the front of the ilium. Have the pubic ramus, which is at the front here, right at the front. And we have right down here, essentially, right at the bottom really, we have the ischial tuberosity, and that's where that is. And now some important ligaments in the spine. Anterior longitudinal ligament, which is at the back of the spine. Alright, runs down all the way down the back of the spine. We have the serrato-iliac ligaments. So these are between the sacrum and the ilium. As you can see there, they're in between the sacrum and the ilium. So they're in between there, the sacrum and the ilium. Alright, we have the sacrotuberous ligaments. So these are situated at the lower back, at the lower and back part of the pelvis. It's flat and it's triangular. So it's in there, it's right in the midst of it all. We have the symphysis pubis ligaments. So these are secondary cartilage joint located between the pubic bones. So right here, right in the middle. And we have the sarcospinaceus ligaments, which are thin triangular ligaments in the pelvis on the outer edge of the sacrum and the coccyx. And again, it's just a case of going through and having an awareness of what all these structures are. So, learn and review. I hope now you'll be able to name, look at and explain the function of skeletal muscle, particularly when you look at page 36 onwards in the lap. We've had a look at the axis that we can travel along, and we've said we need to be aware, guys, that when different muscles are working, what axis are they travelling along, and what planes are we moving through or moving along with. We need to be able to explain the joint actions, which we've done quite a lot there. We need to be able to describe joint structure and motion and injury risks, which we've done. And we need to be able to describe joint movement potential and also look at the pelvis and have an understanding of what's going on in the pelvis, what bones are in there and what ligaments are involved. So, I keep harping on, it is online learning. Have a look if you need to, have a read of these things. But that brings us to the end of this one. Hope you've enjoyed listening and watching, and I'll speak to you all again very, 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 very soon.